We are just covering our the details about our Ars Fraternity, that what actually Ars Fraternity is, and what we provide, what we do. So here we go with this. I hope you all can see this. सबको स्क्रीन नजर आ रही है? So, regarding the Ars Fraternity and about the platform, let's just go through with it. So, the Ars Fraternity Knowledge Fraternity, Ask Skills Knowledge Fraternity is an online learning, and it's also an earning platform. The talent of the humans, online educations for higher educations, teaching workplace skills, and exploring new interests that provide certificates courses and diploma courses as well. Our fraternity provides free of cost international webinars, workshop, and also paid short courses. So for details, you can visit www.oursfraternity.com. So, what is our vision? Our vision is to help people achieve their goals by creating solutions and practical techniques through our trainings and design life changing products to ensure holistic transformation of the people. How? Uh, we have a flexibility, we are individual focus on the students, we motivate the people, we motivate the youth, the youngster to become a trainer like us, and we also inspire through our trainings. So what is our mission further? So we provide the successful career pathways. You can review your jobs. You can even sail environment, especially for the females. It is a safe environment. We are providing a very safe environment for all the women who are joining. They have a privacy of all the details if they are sharing with the numbers and all. So we have our the team members who are working on it. Uh, for all these, we are helping all the youngsters to decrease unemployment rate. We are taking action. We are forwarding with further different organizations. We are taking more affiliations from all around the world, and also we are inspiring and we are energizing the people all around the world so that they can work with us. So our executive team members include Dr. Aksar Abbani. She is our entrepreneur, she's the facilitator, and she's also a life coach. Uh, then we have Mr. Zain Khan. He's the vice president, and also he's working as a finance partner of the Ars fraternity. Then we have Miss Arshia Kainat. She is the CEO and the management controller. This is what our team is, and their main uh, motto is like it says, the a leader is like a shepherd. He stays behind the flock, letting the most nimble go out ahead, whereupon the others follow, not realizing that all along they are become dedicated from behind. So this is the team of our fraternity. Uh, we all welcome you in this platform. So, what is the profile? So, we are a registered an organization. We have our leadership qualities. We are working in the team. We are organizing, and also we are negotiating. And you can see that our negotiation rate is almost 95%. Uh, Further, we are registered with FBR. We are registered with SECP, right? And we are also affiliated with the two different institutions, paramedic institutions, which we will be discussing further. So, about the business partner, our collaborative partners in China is Go Study organizations, and we have our this business partner in all over the China. As you can see in different the areas, you can see very clearly that there are so many institutes who are working with us. We have our affiliation in United Kingdoms with the Right Vision Training Center. Mr. Asjad Sheikh is the governing body, is the CEO, and visiting office is at Lahore with the name of the New Era. the new era learning. So you can visit their website as well. Also, it's a www.rightvisionacademy.com. And affiliations include Al Jannat Institute of Medical Sciences and Bashir Hospitals. So they are both registered by the Punjab government of Pakistan and affiliated by the Healthcare Board. Mr. Shaukat Pasia, he is the founder, and Mr. Shah Pasia, he is the medical director of that institute. And the visiting faculty and the visiting office, you can visit their institute in Sialkot. You can get our registered courses as well on these institutions. Also, we are collaborating with the national partners, include the Al Safa Institute of Paramedic and Rehabilitation Center, which is registered here in the Sindh government of Pakistan, HEC affiliated by the three hospitals. Dr. Pira Khan, also he is the governing body and the CEO. Visiting office and institute at Kasmabad, Hyderabad, and also present in Karachi. And there are many more to come as you will be seeing this. uh, regarding the trainers, we have a team. हमारी एक बहुत बड़ी एक टीम है जो हर डिफरेंट डिफरेंट लेवल्स के ऊपर ट्रेनिंग्स कंडक्ट करती है. ऑल्सो we have a doctors. We are also having the professionals all over the domains, not just the medical, also for non-medical thing as well. Dr. Rita Batul, she's providing the diabetic training programs, that is almost for the 1 month. Hypertension and management program is also 15 days. Ultrasound training program providing in 15 days. Pharmacy technicians and antimicrobial Stepford program is also for the 4 month and 2 months. Dr. Atar Mahmood, providing the 15 days urology training program, best for urologists, for the person who are doing specialization in the urology. Dr. Javeria, she is the oral surgery course planner. She is coordinating this. Also, she's providing 15 days course. Mr. Mansoor Ali, he is providing the natural healing course, which is also the 15 days. And by myself, I am providing the CPR, BLS, ACLS. So that includes all CPR, ACLS, and BLS, which is one part which we are going to cover here in this session. Then Dr. Maham Kashif, she's the gynecologist and this obstetric training program she's providing. She's also doing the ECG interpretation, cardiology training program. Her programs are 1 month till the 2 months. Miss Sumaya Ambreen, she is the English spoken course. She's also providing the English course that is almost for the 2 months. Mr. Bilal Shakil, he is providing the eBay drop shipping training program, a job offer after this completing programs. Maybe you can get the job after by this training. So this almost cost for the 2 months. Then Dr. Aksar Abbani, our president, she is providing the virtual clinical internship, virtual pharma internship, virtual clinical practice internship, then the virtual medical internship, also clinical practices test designed according to the candidate, including from the 15 to the 6 month course, but depend on the candidate how many candidates are registered for this specific courses. So there are many more in queues. Dr. Mohammed Usman is also there. Dr. Mr. Munibul Hassan, a child psychologist. He's also providing the child psychologist course for the 15 days. Dr. Mohammed Usman is providing the X-ray interpretation courses that include the chest interpretation, emergency interpretation, trauma interpretation, orthopedic, and the surgical CT scan. So these are the trainers, and they are going to come and join us by planning this. And now we have the membership card. We are providing the membership card that costs only 2,000 rupees, and it is valid for the 1 year, one complete year. And look at the benefits of it. Uh, you are known your desired outcomes. You know you save money. As अगर आप देखेंगे कि आप डिफरेंट कोर्सेज अगर आप ज्वाइन कर रहे हैं तो डिफरेंट कोर्सेज के लिए आपको अलग अलग 1,000 रुपीज पे करना पड़ेगा. बट विद दिस मेंबरशिप कार्ड you will be getting the courses on a very less charges, or maybe free of cost almost, right? For this, you can get the job opportunities. You get the discount offers for the 30% off on paid program, which is the 1 year validity. uh, for order, if you order it, you can get free delivery of the membership card, and you can even enhance through getting the trainings from our side. As you can see, we have a lot of trainers, we are working with other institutions, and still we are working on it. So thank you. Next, which we are going to be discuss our main topic. So that is the ECG interpretation. What is ECG and how to recognize? Let's just discuss it clearly. Okay, what is ECG? ECG, it's a wave formation. As you can see here on the waves, there are different types of the wave. It says on the P, Q, R, S, T, and there is another T. So we have to understand what is actually is this. Uh, Actually, the definition of the ECG is it is like the graphical representation of the heart, right? So you are seeing a graphical representation of the heart on the body surface. That is called the electrocardiogram. It was invented by a scientist. That name was the William Enthovian in 1904. 1904 के अंदर विलियम एंथोवियन नाम के एक शख्स ने एक ईसीजी को दरियाफ्त किया था, और इस ईसीजी का काम उनको नहीं पता था कि आगे जाकर ये कैसी एक डायग्नोस्टिक फील्ड के अंदर ये चली जाएगी। तो उन्होंने जब इसको आइडेंटिफाई किया तो इट वाज अ वेव फॉर्मेशन, अ काइंड ऑफ, so that wave formation implemented on the patient, on the person, and there are some waves that has been formed. So the wave correspond, that is the P wave. First you can see the first positive deflection is the P wave. It provides the electrical impulses traveling through the atria. So we have the both atria, right and left. So when our atria depolarize, or we can say the contraction, so contraction जब होती है हमारे हार्ट की, so it gives the both atria to depolarize, and when depolarize, the P wave formation is started. Then afterwards, it is the QRS. We call it the QRS complex. Why we are calling it QRS complex? Because it is like a complex. It is like a building. It is like a building blocks. As you can see, Q, R, and S. It forms a complete. So we are calling it a QRS complex. So QRS complex is also a depolarization of the ventricles now. We have already said the heart has the anatomy like the atria and the ventricles. So we have the true atria, and then we have the true ventricles. So in ventricles, when the QRS form, it is the depolarization, it's the contraction of the the left and right ventricles, right? But in that QRS complex, there is also the repolarization phase of the atria, क्योंकि हार्ट कॉन्ट्रैक्ट होता है और रिलैक्स होता है। तो कॉन्ट्रैक्ट हुआ, दैट इज द डीपोलराइजेशन, रिलैक्स हुआ, दैट इज द रीपोलराइजेशन। और वो रिलैक्स कहाँ हुआ? वो रिलैक्स होता है क्यूआरएस पर, पी वेव पर हमारे पास हुआ atrial depolarization, and the repolarization phase is on the QRS complex, right? So the contraction occur on the QRS is the depolarization of the ventricles, and generally again it is responding to the contraction of the ventricles, okay? And now coming for the T wave, so the T wave correspond to the repolarization of the ventricles now, ठीक है? तो ये हमारा कंप्लीट एक साइकिल हो गया जिसमें हमारा हार्ट कॉन्ट्रैक्ट होता है और रिलैक्स होता है, ठीक है? तो पहले कॉन्ट्रैक्ट हुआ एट्रिया, फिर कॉन्ट्रैक्ट हुआ वेंट्रिकल, और फिर रीपोलराइज की तरफ गया, रिलैक्स हुआ हमारा एट्रिया, देन हमारा वेंट्रिकल फिर से हो गया रिलैक्स, और फिर दोबारा ये पंप स्टार्ट हो गया, ठीक है? तो हार्ट हमारा कुछ इस तरह से फंक्शन कर रहा है, ठीक है? सो दिस इज द बेसिक ऑफ द ईसीजी ट्रेसिंग। Okay, coming back to the sinus rhythm. What is sinus rhythm? So the sinus rhythm is every P wave followed by QRS complex, right? So it is called uh, uh, the sinus rhythm. Okay, every P wave followed by QRS complex. It is called the sinus rhythm. So the sinus rhythm have P wave, Q, R, S, and T wave. ठीक है? And the rate is 60 to 100 beat per minute. There is a rhythm that is the sinus rhythm. Like there is a regular rhythm and there is an irregular rhythm. So the rhythm recognition includes, like if you want to calculate that how to identify is it a regular or irregular. So you calculate it between the two R waves, the number of small boxes. But first, we need to identify that what actually is provided the small numbers. The small number of your one small box is equal to first large box is equal to five small boxes, right? One large box is equal to five small boxes, and one small box is equal to 0.04 सेकेंड. ठीक है, ये ध्यान में रखिएगा. हम बॉक्सेस की तरफ जा रहे हैं, तो बॉक्सेस में हमें समझना ये ज़रूरी है कि जब हम समझेंगे इस चीज़ को तभी हम इस चीज़ के ऊपर अमल कर सकते हैं. One small box is equal to 0.04 seconds. So if I calculate 5 all, so it is 0.20 seconds. ठीक है, वन स्मॉल बॉक्स इज 0.04. 5 अगर मिल जाए, 4 5 जा 20, सो 5 मिल जाए तो दैट इज इक्वल टू योर 5 स्मॉल बॉक्स, राइट? So participants, are you getting my point, what I'm saying? Can anyone answer me? How many types, like कैसे हम आइडेंटिफाई करें दैट वन स्मॉल बॉक्स इज इक्वल टू हाउ, कैसे? एनीवन? कम ऑन पार्टिसिपेंट, I would like to ask you, come on class. Come on, Dr. Saab. We have a lot of team. We have a lot of people who have joined us. Yes, so how you calculate the small numbers of the box? One small box is equal to 0.04 seconds. Thanks. Thank you. Thank you for the answers. Thank you. Okay, so what is the five large boxes? And we are calculating. What is the five large boxes? The value is, yes, one box is 0.04, and the five small boxes is equal to, five small boxes is equal to 0.20 second. Yes, that is what I want. Or 0.2 second. 0.2 second जरूर साथ लगाना है. ठीक है, 0.2 second. Yes, very good answers. Okay, so one small box, as I was 0.04. So now what we are doing, the formula for placing this is, we are calculating 1500 divided by number of small boxes between two R waves. ठीक है, so we are calculating from here class with the first one, first R wave to R wave. ठीक है, we are counting how many small boxes are there in between the two R waves. How many small boxes are there in two R waves? Okay, we are getting answers of from Aisha, from Florence. Okay, how many are there? Okay, only 2% has answered. Okay, 14. Is it 14? One large box contain five small. So calculate. No, no, you Sadia, you are calculating the four large. I am talking about the small boxes. One large box is equal to five small. So if you are counting four, so five plus five plus five plus five, that is 20. Yes, that is 20. Very nice. Very nice. That answer is the 20. So now 1500 divided by 20. What is the answer? 1500 divided by 20. What is the answer? Yes, I got you. 1500 divided by 20. What is the answer? Yes, Maruf, you're right. Noor Wali has answered. Sadia also answered, that is 75. So here we got the answer, and the answer is 75 beat per minute, right? So this is how we get the answer, and the normal rate is 60 to 100 beat per minute, right? So very nice answers. Everyone is answering so well. So the definition of the sinus rhythm is every P wave followed by QRS complex, right? And the rate is 60 to 100 beat per minute. One more thing, we have to identify now the uh, uh, the PR interval, and the PR interval starts from the start of P wave to the start of R wave. Can you identify the PR value, start of P wave to the start of R wave, in small boxes, in small numbers? One small box is equal to 0.04 second. PR interval says start of P wave to the start of R wave. How many small boxes are there? Come on, class. I'm talking about the PR interval here now. What is the PR interval? PR interval starts from the normal value. I'm telling you the normal value of the PR interval. The normal value of PR interval is 0.01, 0.12 to 0.20 second. 0.12 to 0.20 second. So that means 0.12 is equal to almost 3 to 5 small boxes. So that is I'm saying the normal PR intervals is 3 to 5 small boxes. Can you calculate? Is it 3 to 5 small boxes? The start of P wave to the start of R wave. Yes, Fahad, you're right. 3 to 5 small boxes. That is what I'm saying. So what is the value? 3 to 5 small boxes. What is the value? I've already told you. And the value is 0.12 to 0.20 second. That means one small box is 0.04 plus 0.04 is 0.08. Then you plus 0.04 is so 0.12. So the normal value is 3 to 5 small boxes. Yes. Yes, Fahad, 0.12 to 0.20. And the value we are getting here is 0.12. Yes, so that is almost 3 boxes. Is that so? Is it so? We are getting 3 boxes here. I'm telling you this is because this is very much important. In the next slides, if we are going to have the rhythm, क्योंकि ये PR इंटरवल ही होगा जो हमें डिफरेंशिएट करेगा कि साइनस रिदम है या नहीं है, right? So the sinus rhythm, the definition of the sinus rhythm is every P wave followed by QRS complex with normal PR interval, and the normal PR interval value is, and the normal PR interval is 0.12 to 0.20. You cannot understand. Hafsa, I'm really sorry about that, but I have a cursor which I can move in here only. I can move here, as you can see. Can you see this cursor? Can you see this cursor movement? Okay. So next slide. Okay. What is the definition of a sinus ready? So the sinus ready is same as the sinus rhythm, but it rate its delay, right? Why? As we can see, the value of the ready is less than 60 beat per minute, right? And only in adult only. Okay. So now, what rhythm is it? Is it a regular or irregular? What do you think? Is it a regular rhythm or irregular? My question is it a regular rhythm or irregular? Come on, class, very quickly. Yes, it is low heart rate, but we are calculating actually here. We are calculating the rhythm. This is a regular rhythm. Yes, agree? Everyone, are you agreeing with Nayab? This is not irregular, beta. This is a regular. How are you calculating from R to R wave to R wave? This is regular rhythm. Regular rhythm definition is R to R. You measure R to R and you then go for the next R to R. It is a regular rhythm, yes. So the formula for regular rhythm is 1500 divided by number of small boxes between two R waves. Let's just calculate. Come on, class. Come on, calculate. What do you think? How many boxes are there? Yes, it is regularly regular. Come on. 1500 divided by number of small boxes between two R wave. What is the value? Come on, class. What do you find? Okay, what is the rate? Come on, class. 1500 divided by number of small boxes. What is the number of small boxes between two R waves? What do you think? No, there is no 7. No, no 20. 20 nahi hoga. There is no 20. Okay, Nayab is saying 41 boxes. No, Nayab, I have calculated almost it's 39. It is 39. The small boxes is 39. Can you count it again? It's 39. So 1500 divided by 39. What you get? Come on, class. I'm expecting the answer from you guys. Come on. Yes, 39. 1500 divided by 39. What is the answer? Okay, Nayab is saying 41. M. Mustafa, you're right on target. You're right on target. Raja Chaman, no, sorry. Yes, Hafsa, 40 small boxes. So 1500 divided by your 40 small boxes is 38. Rafiq, very nice. 38.4. Yes, Ariva, you're right. Dua, you're right as well. Dua Khan, you're right as well. Sara Rajput, you're right as well. Very nice. Everyone is giving the answer. Mohammad Shakil, Dr. Salman, yes, Rizwan. Everyone is on point. Yes. Okay. थोड़ा बहुत ऊपर नीचे है डिफरेंसेस है बट इट इज वेरिएबल एटलीस्ट 10 का फर्क अगर आता है तो वी कैन कैलकुलेट इट यस योर आंसर इज राइट डॉक्टर सलमान यस जहांजेब योर आंसर इज राइट ओके सो द आंसर इज 38.4 that is beat per minute. Yes, 38.4 beat per minute. Thanks, Zonera. Thanks for the clarification. Thanks, thanks, thanks. Okay, what is sinus tachy? What rhythm do you think is? What rhythm is this? First, identify the rhythm. The definition of sinus tachy is a sinus rhythm with a rate greater than 100. Right? 100 से ज़्यादा अगर होगा rate आपका adult में तो that is the sinus tachy. Make sure it has a P wave, it has a QRS complex, it also has a T wave. ठीक है. What rhythm is this actually? What rhythm is this? What do you think? Varda Gondal, she's just answered. She just answered. Come on, class. It should be like Varda. Everyone should be like Varda. Come on. Varda just answered this question. What rhythm is this? I'm answering. I'm questioning you that what actually rhythm is this? Is it a regular or irregular? Yes. Yes, it is regular. Yes, yes. Come on, identify how many small boxes are there in between two R waves. Come on, class. How many small boxes? Yes, it is regular rhythm, but we are seeing there is a P, Q, R, S, T waves. Sinus tech, yes, it is. But what is the rate? I'm asking the rate. I'm asking the rate, class. Come on. What is the rate? What is the rate? The rate should be above 150. Yes, Ariba, there is 9 small boxes. Yes, you're right. 9 small boxes between two R waves. Yes, Jazep, it is tachycardia, but what is the rate? It says greater than 100. It says, yes, it is. So you divide 1500 divided into 9 or divided into 10. If you are finding 10, then write it 10. But 1500 को divide करें, you will get the answer. No, Fahad, your answer is not right. Zunaira, you're right. Maz, you're right. Fahad, no, you're not. 187 is not the answer. Malik, yes, it is the 9 boxes. Yes. Naya, 166.6. Yes. Dot point. Noorwali, no, not at all. Sara Rajput, 150. Yes, yes, yes. So that you got. So you got my point. Yes. So that is above 150. So that is around 150. So sinus techie. Now, coming back to the blocks. What block mean is, first we have to identify what block is. So the blocks are of the three types: first degree, second degree, and third degree. Right? So first degree burn is, first degree says sinus rhythm with first degree heart block is a sinus rhythm with a prolonged PR interval more than 0.2 second due to delay in the transformation from the atria to the ventricle. Because it delays from the atria to the ventricle, that is why the PR interval is prolonged. So the in the first degree PR interval will be prolonged. That's it. Okay? So can you identify how long the PR interval is in this slide? What do you think? In this slide, what do you think, class? What is the PR interval? Thanks, Mansoor. Thanks for the comment. What is the PR interval? Start of P wave to the start of R wave. Start of P wave to the start of R wave. Yes, it is prolonged, but how many small boxes? Come on. It says more than 0.02 second. If it's 0.02 second, then you can say it yes. How many? Yes, it is regular rhythm. It has P wave. It has QRS complex. Okay, the rate is fine. I'm asking about the first degree heart block. Prolonged PR interval, yes, but how many boxes are there? How many small boxes? The normal value is 0.12 to 0.20. Okay, now can you find how many small boxes are there? Okay, so what I see is almost 8 boxes. It almost 8 boxes are there. Small boxes. Start of P wave to the start of R wave. Okay, you can see here. Start of P wave to the start of R wave. So this is the prolonged PR interval in the first degree block. Okay, now for the next one, second degree block. What is second degree block? Second degree block are of two types. One is Mobus type 1, which is also known as the Wanky back, and Mobus type 2, right? So there are two types of heart blocks in the second heart block, right? So in heart blocks, in first degree, uh, your PR is progressive. It's keep on progressing, and suddenly the QRS complex is dropped, right? As you can see here in the first image. In the first image, as you can see, if you can see, uh, I request all the participants if they can stop commenting so that I can the rule out uh, this sheet strip. As you can see, in this PR interval, you can identify how many number of small boxes are there. There is three, and there is almost one, two, three, four, and five. 8 boxes. In next slide, identify the boxes. Almost four, five, six, seven, 8, 9, 10. Almost it is the 10 boxes now, right? And then suddenly you can see that we have a PR, we have the P wave, but the QRS complex is dropped now, right? So this is second degree movers type 1, that is Wanky bag. तो the Wanky bag उसमें क्या होता है कि पहले आपकी P wave आएगी, फिर जब दोबारा पी वेव आएगी तो वो प्रोटॉन मिलेगी, फिर दोबारा पी वेव आएगी तो अब आपके पास क्यूआरएस कॉम्प्लेक्स ही आपको ड्रॉप मिलेगा. मीनवाइल इन Movers type 2, see, you see that the PR intervals remain the fixed. PR interval remains the fixed, but suddenly your QRS complex goes down. You can count. You can see here that the P wave remain constant. P remain constant. Again, P remains constant, and suddenly your QRS complex drop out. Right. So this is Mober's type 2. Mober's type 2 is also the hard block, an intermittent, that is the QRS, that is not in a Mober's type 1. This is the only difference. QRS complex हमारे पास जो पैटर्न हुआ था, एंड द मोबस टाइप 2 के अंदर क्या हुआ है कि हमारे पास जो पी वेव है वो हमारे पास कांस्टेंट रहती है, ठीक है, और हमारा जो क्यूआरएस कॉम्प्लेक्स है वो हमारा ड्रॉप हो जाता है. What is third degree block? Okay, third degree blocks is called also the complete hard block. It has no relationship between the P wave and the QRS complex. Sometimes it is near, sometimes it is away. But the P to P interval is remain the same, and the QRS complex on the ECG shows like this, right? So this is what you call the third degree block, right? So this is called the complete hard block. There is no sequence at all, no sequence. कहीं 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 पर आप देखोगे क्यूआरएस कॉम्प्लेक्स के साथ पी वेव आ रही है, कहीं करीब आ रही है, कहीं आ ही नहीं रही है. So there is no such sequence of the third block. Supraventricular tachycardia. What is supraventricular tachycardia? Supraventricular tachycardia is rhythm with narrow QRS complex. As you can see, the QRS complex is narrow. The only rhythm which is regular and it is narrow, supraventricular. And besides all of this, we will find all the rhythms will be irregular then. So when the impulses originate with the bundle branches above the other. Okay, can you identify how many boxes are there and what is the rate of the supraventricular tachycardia? What is the rate of SVT? What is the rate? Class, can anyone answer? Yes? Okay. Are you sure? How many small boxes? 10 boxes. Okay, yes, it is 150. So it is 150. No, no, no. 160. No, Ruth. No, no, Naya. It's 150. Yes, it is 150. So the rhythm is 150, and you get the SVT. Only SVT way is that regular, and you will see it above the bundle branches, and you will identify that it has a narrow QRS complex. Now, atrial fibrillation. This, as you can see, guys, we need to stop the comments. Okay. Now, atrial fibrillation, known as the AFib or AF, it is a arrhythmia. It is irregular. So the rhythm is characterized by the no wave before the QRS complex, and a very irregular heart rate. Very irregular heart rate. You can see RR sometime near, RR is sometime away. Again RR is near. Again RR is away. Again near. So this is irregular. The rhythm is either regular or either irregular. For now, the formula for the irregular, that is the 1500. Sorry, that was the for the 1500. But for the regular one, here now we will be calculating 15 large boxes. We will be calculating the 15 large boxes. Now here we will be identifying 15 large boxes, or in 3-second lead. 15 large boxes, and we'll identify the number of R waves in it. How many number of R waves are there? In atrial fibrillation, we will continue identifying the R waves. So we count from the start: 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, and 15. Okay, so 15 large boxes now, not small boxes. 15 large boxes, and we are counting number of airways. It's one, 2, 3, 4, 5, and 6, and it is 7. So we have Okay, class. I hope you guys can hear me. Hello. Hello. Okay, class. So next it is the ventricular fibrillation. Can you guys hear me? Yep. Okay. What is ventricular fibrillation? Ventricular fibrillation, it is a bizarre formation of rhythm. As you can see, यहाँ पर कोई P wave और P wave के अलावा हमारे पास QRS complex कोई हम कुछ समझ नहीं आ रहा. So that is ventricular fibrillation. You can see it's a fibrillatory movement, right? So this is the rhythm. That rhythm is called the shockable rhythm, right? This is the case which patient needs to deliver a shock. Patient needs to give a shock here. So that is why it is called the shockable rhythm. In this case, you give the 200 joules to the patient, and if patient is unconscious, it can revert. So defibrillation is the way to correct this rhythm. Next. In the next slide. Can we do the next slide? Can we do the next slide, please? I'm unable to do that, and I'm unable to do the next slides. Okay, so this is about our session, and we are going to start our CPR, BLS, and ACLS AED course. That is starting from our 2nd or almost 3rd June. That is including the basic emergencies, includes the fundamental principles, cardiac arrest versus the heart attack. There is a level of consciousness and the CPR, domestic and heart related emergencies is there. We will be covering the basic life supports component. We are completing how to use an AED. Also, we are covering the advanced cardiovascular life support. We will be identifying how to use the defibrillator and emergency medication, and also in the case study. So this is the 15 days course, and the only charges is rupees 1000 only. You can go in different institution, you will be paying the 10,000 or 20,000 or even a package of almost 50,000 rupees and all of that. But we as fraternity, we are providing only at just rupees 1000 only, class. So you can get this course details. You can email us on the info.askf@gmail.com. You can contact after that session if you are interested for this course. We will be telling you about this course in detail. We will be providing you the free of cost materials. We will be providing you the presentations of it, and there is the assessment test also. And after assessment, there will be the 2 types of assessment, as it is of the two weeks course. One will be on the first week, and the second will be ended with the final exam sheet, and afterwards, when you clear this exam, you will get your certificate through our management. So any question, class? We have last 5 minutes. We are affiliated, yes, and it's only charged rupees 1000 including the affiliated certificate. Yes, it is. So if there is any question about the course, you can ask. It will be the online course, and we will be covering very good objectives with this. This was just a masterpiece. This was just a course which we have provided you in a very basic way, that how we are going to do this course. So I hope you have identified, you have learned a lot in this class. So I would request all of you to participate
so that we can have more and more students like you, and we get the benefits from and you get the benefit from us. So this is what I want. Thank you, Shakil. Thank you so much. Is there any question? Is there any questions? So I would like to open, or we can end this webinar so that you can avail your certificates with us. You can get all this course. I have done all these courses with the affiliated institutes, and that cost me almost 70,000. That cost me almost 70,000 rupees. But we are providing, our fraternity is only providing you a course that is only rupees 1,000. Just 1,000 class, just imagine, and it's a 15 days practical and also assignment based training. You will be benefiting in all these classes, and make sure that you will not be finding alone yourself. You will be definitely finding that you learn at least something. आपने कुछ सीखा है. You will find this. So thank you, class. Thank you so much for your time. Thank you so much for your commitment. It was a very nice time with you. In during session, there was some mishap. As you know, we have some electricity issues, so that is why we got this problem in between. So thank you, class. Thank you again. We are affiliated again. Yes. So jazakallah khair. Thank you so much. Allah Hafiz.